What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises for a condition called posterior tibial tendon dysfunction. So if you have pain on the inside of your lower leg, the inside of your ankle down to the arch of your foot, or if a doctor has told you that you have tibialis posterior tendinopathy or tendon dysfunction, then these will be exercises for you to implement. So when we think about this condition of tibialis posterior tendon dysfunction, tibialis posterior is a muscle that again runs on the inside of the lower leg. It runs on this medial side. If you find your shin bone, it runs right to the inside, all the way down behind this bone, which is called the medial malleolus. The tendon runs right through here and attaches on the arch of the foot. Tibialis posterior is technically in the same compartment as our calf muscles, so it helps to point our foot and to turn our foot into inversion. When we're standing and putting weight on our leg, tibialis posterior helps to control our arch. So it lifts the arch and eccentrically controls the arch when we put weight in our foot. So it's a really important muscle and tendon in terms of acting sort of like a shock absorber for our arch. When people have issues with the tendon, they can develop tendinopathy, so they'll have pain on the inside of the arch. And then if that tendinopathy goes on for long periods, it can turn into something called tendinosis and can eventually lead to degeneration and a breakdown of the tendon itself. This usually happens to people in middle age, and if it does happen, what will happen is the person's arch will slowly collapse, leading to a flat foot. So this is an acquired flat foot that we see in some adults. If you notice that you're starting to have pain on the inside of the ankle in that tibialis posterior tendon, maybe you're having pain when you do calf raises, then it's really important to start addressing this early. If you catch it early in the first few stages, stage 1 and stage 2, it can recover, and in most patients can heal. Up to about 90% can heal within 4 months. If you let it go on for too long and your arch collapses and you get into the worst stages, stages 3 and 4, it can be difficult to regain arch height and strength, and you'll end up losing function in your foot. So besides the exercises I'm going to show in today's video, you also want to look at things like orthotics and maybe even visit your doctor. Some people need to be put in a boot and to have their foot immobilized for a period of time to let the tendon heal. So let's go ahead and get into the first exercise. Our first exercise here is called doming, and we're essentially going to teach our neuromuscular system to lift our arch. This does take a fair bit of practice, so if you can't get it right away, that's okay. Just keep working on it, and eventually your nervous system will figure out how to connect to the muscles in the arch of your foot and lift the foot. So Kirsten is going to go ahead and zoom in here and show. I want you to start sitting. Sitting is an unloaded position without our body weight. It's a better spot to start. So what you're going to do is we're kind of thinking about squeezing these muscles deep in the arch of our foot. We have a bunch of layers of muscles here. We're going to keep our heel on the ground, the ball of our big toe, and then the ball underneath our pinky toe, our 5th toe. And we're going to essentially do kind of what's called a short foot exercise or doming. I'm just squeezing those muscles, kind of thinking about doing a crunch of my foot so that the arch lifts. So I'm not lifting my foot off the ground, the ball of the big toe stays down, but I'm thinking about shortening my foot. So I'm pulling the foot together by squeezing these muscles. It kind of shrinks in length and then letting it go back out. Not only will this strengthen some of these deep intrinsic muscles of the foot, but it will also activate tibialis posterior in a gentle way to start training those muscles and that tendon. Now, if sitting, you can get to do this pretty easily in sitting, then you want to transition to standing and putting your weight on your leg. That's just going to be sort of a progression. Once I put weight on my leg, it's of course more functional, and it's more challenging just because I've got a little bit more weight over that foot. So for an exercise like this, it's not really a strengthening exercise, it's more of a motor control exercise. I want you to try and think about performing 10 to 20 repetitions and try to do it several times throughout each day, maybe 4 to 5 times each day, to really teach that neuromuscular system how to create that movement. Okay, so that is our first exercise. It's called the short foot or the doming exercise. The second exercise is called a towel curl. This is going to be another one that's fairly low in terms of how much stress we're putting on the tibialis posterior tendon, but it's a great one for, again, just sort of activating those muscles and teaching them how to contract. So this is called a towel curl. What you're going to do is take a hand towel, kind of fold it in half and set it on the ground, and then start with your toes sort of on one edge. And what I'm going to do here is just perform a towel curl. So I'm using my toe flexor tendons and muscles, again, deep in the arch here, and then they also run up the lower leg with tibialis posterior. I'm going to pull, so I'm kind of doing a little bit of that short foot exercise we were doing a second ago, but now it's a little more biased towards my toe flexors. So I'm essentially just going to pull this in until it kind of binds up in my arch like this, and then I'm just going to straighten it back out, kind of think of that as a rep, and then start over and just pull in and work on kind of, this will to some degree strengthen these muscles. They're such small little muscles, they don't need really high load, but it is kind of more of an activation and neuromuscular control exercise. So like the last one, like the short foot, maybe think about going through 10 reps or something like that of this one. And again, see if you can get it in a few times a day. Maybe shoot for 3 times a day for something with this one. You can go up to 4 to 5 like the last exercise if you have time for it. Okay, so that is our second exercise, the tau curl. Our third exercise is called band and inversion, and we're going to use a piece of TheraBand. I'll put a link for this down in the description box if you need to get us out of this. You're going to tie a loop in it, and then what we're going to do is on the affected leg, and I would really encourage you to perform these exercises on both sides if you only have it on one side. So what you're going to do is take the loop, put it over kind of the front of your foot, kind of the balls of your toes. You're going to straighten that leg out and then pull the band out at sort of an oblique angle out to the corner. And then what I'm going to do is practice going through plantar flexion, pointing my foot, and then turning my ankle in inversion, and then back out nice and slow. So tibialis posterior helps with plantar flexion, which is when we point our foot, and then it's an ankle inverter, so it turns our ankle in, and then we want to go back nice and slow. Don't let the band snap you. So you start out here in dorsiflexion and eversion, and then we plantar flex and invert to work tibialis posterior. TheraBand comes in different colors, so the colors signify the resistance level. I've got red here, which is kind of on the easier side. This is probably too easy for me, so what you can do when you're working through this is if you pick a particular color and you can do, say, 10 to 15 reps, they're easy, and you don't have any pain, then try to go up in the resistance level. You want this to be challenging to where when you get to maybe 10 to 20 repetitions, you actually feel some fatigue in the muscles, but you don't want to have more than mild pain on the inside of the leg in tibialis posterior. So try to keep your pain at a 3 or a 4 out of 10 or lower. If it goes above that, then you need to drop your resistance a little bit or maybe do less reps, something like that. Okay, so the key with this one is just an ankle movement. You can see my kneecap is always pointing towards the ceiling. Don't turn your whole leg in. You don't want your hip to be involved in this. It's just an ankle movement. So you're strengthening tibialis posterior, putting load, good load on its tendon, and also working a bit on neuromuscular control. So go for 3 sets of 10 to 15 repetitions of this one, and it's an exercise you can perform every day. The fourth exercise here is definitely going to be the most challenging for tibialis posterior. It's going to be the best one in terms of strengthening the muscle and tendon. For this exercise, you'll need a ball, just something about the size of a tennis ball, and we're essentially going to be doing a calf raise where we have to hold the ball, which will help to activate tibialis posterior. So what you're going to do is stand near a wall or a countertop for balance, take the ball and put it between your heels, and then what you're going to do here is again kind of hold on for balance, and we're going to do a double leg calf raise. But what's going to happen is as you go up and down, you have to hold the ball in place while doing the calf raise. Tibialis posterior, you'll remember, helps to point our ankle, so it's an ankle plantar flexor. It works with our calf muscles, but then it's also an ankle inverter, so it helps to turn the ankle in. So this is more of a strengthening exercise, so think about doing 3 sets of 10 to 20 repetitions. You can do this every day unless you start to experience pain in tibialis posterior. If that happens, then you can switch to every other day to allow it some time to heal in between your exercise sessions. Thanks for checking out today's video. I hope you find the exercises to be helpful. If you need a more comprehensive resource, my book is available on Amazon and Barnes & Noble. Each body region has its own chapter, and it covers the most common issues. If you have something like tibialis posterior tendon dysfunction, you could go back to the shin splints program. This program is going to have a bunch of exercises and strategies to help reduce tibialis posterior pain and to strengthen this muscle. You'll see right here, here's a tibialis posterior massage or mobilization with a ball or with your fingers. I didn't show this in today's video, but this can be a helpful technique for reducing pain. So you'll find that these types of exercises in phase 1 for reducing pain. You can see all of the exercises include pictures of me doing the exercises, and all the programs are broken into 2 phases. Here's our banded inversion from today. And then phase 3 will focus on more challenging resistance training or strengthening exercises that you can do at home. So if you'd like to have a resource like this that allows you to do your own physical therapy at home, I will put an Amazon link for the book down in the description. Thanks again for checking out today's video. I'll see you in the next one. Bye.